Hi, this is Meenakshi Jolly. I would like to talk about what are some of the preventive healthcare things that should be taken into account by patients with lupus. Now, some kind of preventive care is important for all patients with lupus, and so all lupus patients should have a primary care doctor that provides care for them. They should not depend only on their rheumatologist to provide this care. Usually patients with lupus are women, and if they're sexually active or in the right age group, that is they're adults 18 years and above, they need a Pap test. This is a test of the private organs, private area of the woman, looking for any kind of infections in the vaginal area or things that could lead to cancer over time. This is a test to screen for cancer. If diagnosed early, treatment can be done in time for this. Pap test is needed. Mammograms for women above 50 years old are indicated for patients, any women above that age. But if you have any family history of problems with breast or breast cancers or any other personal history, do discuss it with your primary care doctor, and you may need a mammogram earlier than that age. Other than that, lupus patients, because they are on medications that can suppress their immune system, do need a flu shot, a killed flu shot as an injection, not as drops in your nose, once a year. The other thing is, if you're on medications that suppress your immune system, you may benefit from also taking a pneumonia vaccine called what other preventive care. For sexually active women in the right age group till age of 25, Gardasil injections are available to prevent against HPV infections. You do need to discuss with your primary care doctor. Even for men in this age group, this may be effective. Other than that, looking for bone health is very important. If you are on long-term steroids or have had fractures, or you are past the age of menopause, that means you don't get periods anymore, whether that is from natural thing, or you had any surgeries, or from any of the medication side effects, then you need to get a DEXA scan. Usually around menopause age or even earlier in the situations I mentioned, and this can be repeated every 2 years or such. Risk for heart disease is increased, so attention to your cholesterol, your HDL, good cholesterol, bad cholesterol is also indicated. Other than that, if you smoke, chest x-ray may be needed. A PPD test, which is to test for tuberculosis, since you are on medications that may require this, may be indicated. Discuss all this with your primary care doctor so you're up to date on your preventive health care.